Hello everyone, my name is Kayla Villalpando. Here's my presentation on addressing substance use disorder in Rio Arriba County. For those of you who don't know where Rio Arriba County is, it's highlighted here on the map in red. Rio Arriba County is just under 5,900 square miles. I live in this community and I have seen firsthand how substance use disorders affects families, friends, and the entire community. Just to give some perspective, according to the New Mexico Department of Health, Rio Arriba County reports 84.6 drug overdose deaths per 100,000 in the population. The state average is 50.4 per 100,000, and the national average is 32.4 per 100,000. As we can see, Rio Arriba County is significantly higher. And this leads to strains not only on the individuals, but their families, healthcare providers, and community resources. The Healthy People 2030 objective that is relevant to my plan is the reducing proportion of people who had substance use disorder in the past year. This project aims to implement prevention strategies and increase treatment access to meet this goal. Okay, so let's talk social determinants of substance use disorder. Economic stability. 23.2% of the population in Rio Arriba County live below the federal poverty line. But that's not the only determinant. Access to health care. You have these rural communities spread out across the county that have a hard time accessing essential primary care, which makes it that much harder for mental health care and any kind of addictions treatments because these communities are so spread out. One of the big determining factors is generational trauma and generational substance use. A lot of times what we see is the grandparents will have substance use disorder, and then the parents will have substance use disorder, which leads to the children having substance use disorder. So it creates this cycle. Here's a list of places in Rio Arriba County that treat SUD and help individuals seek treatment. I was able to talk with the Rio Arriba County Health and Human Services Department Director, Dr. Ahmed Dadzi, and he did say, well, judges do often court order, court mandate that people seek treatment and gain treatment. He did say that he sees long-term recovery when people seek treatment on their own. What he has seen in his experience is that when people are court ordered, they'll follow the court order until they're released from, the judgment, and then they often return to substance use. But long term, he sees that it works out better as far as recovery efforts when they seek it on their own. So here's my plan. My ideal program would need an estimated $250,000 annually for educational materials, staff, treatment support, and outreach. We would resource brochures, social media campaigns, overdose reversal kits, and recovery support. We would do this for 1 year as a pilot program and then followed by 3 years of full implementation. So my program heavily relies on community support, getting into the schools, talking to kids, healthcare providers, law enforcement and first responders, local government and policymakers to make sure that there are options, that everyone is informed and they know what treatment is out there and where they can get access or information. And then also target individuals and their families, because as long as as individuals have support and know where to go, then they are more likely to seek treatment. So I've given you my plans, my program, but I haven't told you my plan. So I'm going to use the Precede Proceed model. We have already the precede information, identify community needs, predisposing factors, and barriers to treatment. And then the precede is implementing the evidence-based interventions, prevention strategies, and assessing outcomes. So what that would mean for my model is getting out there, giving interventions, letting people know that there is support, whether that be remote, the support team traveling to them. There are many different options in my plan. Here's a list of evidence-based programs that we know to work. The LST, the TGFD program, which both target youth, the MAT program, which is used to help people with opioid disorder kind of wean themselves off. And then there's the stigma reduction, which I think is huge. I think people who are embarrassed to receive treatment or to admit they have a problem. So when you put this with peer support, people who have been in their shoes and have done that, they can see that they can do it too. So when it comes to implementing, we would conduct substance use prevention workshops in schools. We would provide screenings and outreach events. We would provide kits to first responders and families and expand our telehealth services. We would also consider the ethical stuff like the confidentiality, the respect to the cultures and social dynamics. As far as evaluation, we would do pre and post surveys, treatment utilization to collect data, annual overdose rates, and then community feedback to see what's working and what's not working. So here's the conclusion. My initiative aims to reduce substance use rates and prevent overdose deaths and increase treatment and accessibility in Rio Arriba County. We would address the social determinants of health, implementing evidence-based strategies, and fostering community engagement to create a sustainable improvements in public health to Rio Arriba County as a whole. Thank you everyone for listening. The next slide is going to be my references. Have a good rest of your day.